Hello everyone, Assalamu alaikum. For those of you who don't know me, my name's Shahida and I work for a charity called Action on Postpartum Psychosis. So this is the first in a short series of videos that I'll be posting as part of Maternal Mental Health Awareness Week. And the theme this year is My Voice, My Strength. And the theme really resonated with me, which is why I wanted to produce these videos, because my voice is central to everything that I do in terms of the work that I do around raising awareness about postpartum psychosis, which is what this video is all about. So my video is called Let's Talk About Postpartum Psychosis. So people talk about postnatal depression. They talk about experiencing anxiety after birth. They talk about having the baby blue, but no one ever talks about postpartum psychosis. And so many women that we talk to all say how they'd never heard of postpartum psychosis before it happened to them. And had they been told, had they been informed about it beforehand, perhaps they would have got help sooner. So what is postpartum psychosis? So postpartum psychosis is characterized by a rapid onset of symptoms in the days, weeks and months following childbirth. Some women can experience postpartum during pregnancy, but it's not common, but it does happen. So what are the symptoms? Some of the main symptoms are experiencing hallucinations. So seeing and hearing things that are not there, hearing voices, delusional thoughts, so really irrational beliefs that other people don't believe, rapid change in their mood, having severe mood swings, experiencing confusion and paranoia, so believing that people are out to get them, to harm their baby, not being able to trust their family, their loved ones, sometimes their husbands, being very suspicious of everyone. Women experience mania, which is extremely high mood, so feeling elated, really excited, very excitable, almost giddy. Women behaving in a way that is completely out of character for them. So they talk about women behaving without any inhibitions, so saying and doing things that are inappropriate, and again just totally out of character for that person. In terms of treatment and help, so postpartum psychosis needs to be treated as a medical emergency. Most women need to be admitted to a specialist mental health unit called a mother and baby unit for treatment. Again, like postpartum psychosis, people have never heard of MBUs, as they are called, mother and baby units. They're sometimes standalone hospitals, or they are specialist units within a psychiatric setting, and they are places where a mother is admitted with her baby for treatment. So we're talking about specialists, doctors, nurses, clinicians, psychiatrists who are specially trained to treat ill mothers with the conditions like postpartum psychosis and severe postnatal depression. Women need medication, so they can be treated with antipsychotic medication, mood stabilizers, and also sleeping tablets to help them sleep. My apologies, when I mentioned signs and symptoms, one of the things that women experience is not being able to sleep, and then that kind of escalates into not wanting to sleep, feeling as though they don't need to sleep. So almost, behaving like a super mom, functioning on empty. They feel as though they don't need the rest, they don't need the sleep, because they can just keep going and going. Just going to quickly talk about causes. So although direct causes are not fully understood or know, more research needs to be done, there are some factors that can be taken into consideration. So any history of mental health illness, such as postpartum psychosis in the family, can make you more susceptible. Women who have a diagnosis of bipolar disorder, a 50% have a 50% chance of developing postpartum psychosis. Again, we know that during pregnancy there's a huge change in a woman's body in terms of hormonal changes, and again during childbirth, at childbirth, we know that there's a huge drop in hormones in the body as well. So again, a lot of hormonal fluctuations, and I just mentioned sleep deprivation is also a factor. A lot of women who experience postpartum psychosis talk about being sleep deprived. One of the other things, again, more research needs to be done, but people talk about past trauma being a factor. So that can be birth trauma, it can be pregnancy trauma, but it can also be previous trauma as well. We know that some people say that postpartum psychosis can be understood as a stress response to trauma. So that's another factor in terms of the causes. Recovery. So women respond really well to medication when they are admitted and treated with the right medications. And this is the main point I want to make in my video, is that although postpartum psychosis is extremely traumatic, it's scary for the woman who is experiencing it. It is scary for her partner, for her husband, for the family around the woman watching someone fall ill and deteriorate. It is a scary thing, but it can be overcome, and you can make a full recovery, and you can move forward from it as well. Postpartum psychosis doesn't define you as a mother. It doesn't define you as a person. A lot of women in the early stages of recovery talk about feeling as though they'd never be the same again, but that is not true. Women do make a full recovery. I want to give that positive message that there is help and support out there. Like I said, the specialist mother and baby unit, specialist medication as well. And that's the end of my first video. Hopefully you'll keep watching, because I'll be posting a few more videos. My next video is going to be my own personal postpartum psychosis story, so I'll tell you a little bit more about my own personal experience and my recovery story as well. If you would like more information, if you've been affected by postpartum psychosis, would like some support and help, please do visit the website for Action on Postpartum Psychosis. We have lots of information, lots of support, which I will talk about in one of my next videos as well. But if you'd like to visit the website, it's www.app-network.org. Thank you so much for watching.
رسول يزيد الأمل ويأتي القبول بخير العمل صلاة سلام